Good afternoon. I have the privilege of introducing Dr. LaTonya Trotter, who will deliver this afternoon's commencement address. Dr. LaTonya J. Trotter is an associate professor of bioethics and humanities at the University of Washington. A medical sociologist, ethnographer, and author, Dr. Trotter is the author of More Than Medicine: Nurse Practitioners and the Problems They Solve for Patients, Healthcare Organizations, and the State. The book, which was published in 2020, chronicles a group of nurse practitioners as they care and provide for 400 Black older adults living with poor health and limited means. Dr. Trotter explores the care they provide and how it addresses medical, social, and systemic issues that are prevalent in underprivileged and underserved members of the community. Dr. Trotter has also published in the Journal of Contemporary Ethnography, Social Currents, and Gender and Society. On her website, LaTonyaTrotter.com, Dr. Trotter states, "As a scholar, I take the prominence of healthcare seriously, using its terrain to understand how regimes of inequality are reproduced through the social construction of problems, patients, and professionals." Dr. Trotter was awarded a Bachelor of Arts from Williams College, majoring in sociology and American studies. She earned a Master of Public Health from the University of Washington and a Doctor of Philosophy and Sociology from Princeton University. Prior to her position at the University of Washington, Dr. Trotter was an assistant professor of sociology at Vanderbilt University. Please join me in welcoming our keynote speaker, Dr. LaTonya Trotter.
Excellent. Thank you, Dr. Schlager, for that generous introduction. And I have to say, I was just really so honored when President Stone invited me to speak with you today, because I am someone who has quite literally built a career by listening to and learning from advanced practice nurses. Nursing, as the saying goes, has proven to be the founder of my feast. So whenever I get a chance to give back to the community that I've come to know, I say yes. And I'm here. But I'm not going to bore you by talking about my research, mostly, because today the spotlight is on you and your accomplishments, because what you have achieved is significant. I cannot know what individual hurdles each of you face to get here, what sacrifices your partners, children, and parents may have made in supporting you. But I do know there isn't a person among you who have not had hills to climb. I may not know exactly what it feels like to get a graduate degree in nursing, but not that many years ago, I had my own experience with being a graduate student. So I know firsthand, it ain't easy. So congratulations to each of you for making it through, for fighting the fight, and for staying the course. But I want to do more than congratulate you on your achievements to date. I want to congratulate you on what you will accomplish in the days to come. Because today we celebrate, tomorrow you rest, but come Monday, each of you will have a job to do with new hurdles to face. Because you are one of many cohorts of nurses of all kinds who are graduating into the single greatest healthcare disaster of our time. So for the last few months, I've been interviewing nurses, most of whom work in the acute care setting, and they've been sharing their experiences with me working on the front lines of the pandemic. I spoke with a cardiac pulmonary nurse a few days ago, whose unit has become, for all intents and purposes, a COVID unit. And she spoke to me not only about the death and suffering that she's witnessed, but of the horrors of the mundane. She recounted how her hospital is releasing patients earlier than they otherwise might in order to free up capacity. Patients who are then re-entering the community with higher needs for care. She talked to me about seeing more patients who, on top of their acute medical needs, are struggling with alcohol and drug dependence, with anxiety and depression. And now, because of the pandemic, they have gone literally years without a consistent source of care, and they are coming home. And we'll turn to many of you. I recently interviewed a nurse practitioner, much like you actually. She was a new NP grad who was working at a neighborhood health clinic. It's a federally qualified healthcare center. All of her patients struggle with social and economic precarity. And she talked to me about what she's seeing about how the pandemic is shaping her own practice. She said, obviously an outpatient, the patients I see don't have COVID, but many of them had COVID in the past year. And things just haven't gone back to normal. And we're trying to figure out what exactly their new baseline is going to be and what other things we can do. Some of them were hospitalized and intubated, they were in comas, and they're really starting life from a totally different health point than they were a year ago. She talked to me about her struggles to provide the kind of care that is sensitive to the national trauma of the last 2 years. And she told me it does become extremely mentally taxing because there's just so much trauma that's not even yours, right? I'm not the sick person, but I'm hearing their stories and helping them navigate these things. And the pandemic has only made that worse. So these are the words that she used to narrate the struggles of her practice. And so it may be for many of you as you enter the community. Now, I know that these are things that most of you already know, that you have some experiences with, and you probably don't appreciate me reminding you of all this doom and gloom as you graduate. But I began my remarks by saying that I wanted to celebrate you for what you will achieve in the days to come, because I know that the challenges that are to come are ones that you can meet. Because I'm not suggesting that you can solve the social, political, or economic problems that your patients face from inside the exam room. That room is much too small and much too humble for something as grand as world peace or justice for all. But that room is just large enough for you to meet your patients where they are and to help them get to the place where they can fight these battles on their own terms and in their own ways. Because speaking as a patient, I can say that when you're fighting for your life and the lives of those you care about, it matters. It truly matters when you know that you can walk into a medical office or a clinic and feel that you found an ally, a willing partner who can help you find and marshal your own resources to fight for life, to fight for dignity, for justice, and for joy. And I know that you all have the capacity to be this kind of ally and to be this kind of provider. And I know this in part because you've been educated in the tradition of Frontier Nursing University, whose historical commitment to meet the needs of the underserved has not diminished, but has only grown stronger with time. You are graduating from a nursing school that has literally become the standard bearer and what it looks like to live out a commitment to create a nursing workforce that looks as diverse as its patients. But I also know that you're up for the fight because of what I know about nursing as a profession. I know that you as nurses are capable of doing what needs to be done because, as I said, I've made a career studying you and learning from you. And there are at least 3 things that I've learned about what advanced practice nurses bring to healthcare. You've all spent years here at Frontier Nursing, learning new things about your patients and learning new skills. But the thing that really will make you special is how you employ that knowledge and how you deploy those skills. And one of the things that grounds that uniqueness is one, the diversity of life experiences that brought you into nursing. So when I first began studying and learning from nurses, I spent time with a cohort of students, just like you. They were FNP students. And I sat in classrooms with them and interviewed them. And one of the things that struck me most was the diversity of ways in which people entered into advanced practice nursing. Many of the students I spoke with, like you, had worked as CNAs, as home healthcare aides, as LPNs before becoming nurses, registered nurses. And I began to understand that it was because of these experiences that often enabled them to be the provider in the room who truly understood what their patients had experienced or would experience when they navigated the larger healthcare system. They knew, as you know, because you've been there. I met students who probably, like some of you, came to nursing a little later in life, perhaps as a second career, who brought experiences as teachers and raising children, working in retail, selling insurance. And those experiences too help you to know who your patients are and what they're struggling with. You don't have to read about their experiences in a textbook. You know the kinds of lives that your patients lead because you've lived some version of it yourself. Now, of course, I'm not describing everyone's experience. There are some of you in the audience where this is your first career. Maybe you went straight from undergrad, did 2 years on the floor and came straight to Frontier. But even you've worked alongside your colleagues, sat with them in class, and learned to value this diversity of experiences that they are bringing to the profession and to the classroom. Now, there are things that I cannot know about nursing as an outsider, but sometimes the vantage point from the outside can help one see things that you may not see from the inside, because nursing does not always see this diversity of experience as a strength, right? Quite frankly, it doesn't always fit with the professional image that nursing wants to project. But from the outside looking in, I want to tell you truthfully that it is this diversity that makes you unique as a professional. You are who you are because of how you came to nursing and how you have changed nursing practice by bringing that experience to bear in the classroom and at the bedside. The second thing I've learned about advanced practice nursing is that you all bring an experience that your physician and physician assistant colleagues with whom you share your patients do not have. And that is the experience of being a nurse, of being at the bedside. And that too is a different vantage point from which to understand patients. I remember speaking with one NP student many years ago. He had come back to school after working at the bedside as an RN for 8 years. And I remember asking him to describe to me what the transition from doing the work of an RN to that of an NP was like. And he set me straight really quickly by saying, I'm still a nurse. I'll always think like a nurse. He told me that he believed it was his RN experience that was really essential to shaping how he saw his role as a nurse practitioner. For him, quote, the unique experience of being a nurse is being with people at a very vulnerable time in their lives. When you don't have to worry about prescribing meds or ordering tests, it really frees up a lot of time for us to simply be with the patient and to not just see the patient as a medical diagnosis or a set of problems. I think having that experience as a registered nurse and interacting in that way with patients and families gives you a unique perspective on primary care, which is to say, from his perspective, he did not transition, he did not change, he simply deepened in how he embodied nursing practice. So much of what you bring to advanced practice nursing is not just the addition of new knowledge and skills that you've learned from inside the classroom, but of something more existential. Right? It's about a kind of difference that is learned through the experience of being a nurse. So whether you had an entire career at the bedside before you came back to school or only 1 year, every minute of that time matters, because that experience of being a nurse matters for you, for your clinical practice, and it will eventually matter for your patients. And finally, 3, what I've learned about advanced practice nursing is that the experiences that brought you to nursing and the experiences that you've had through being a nurse all come together to create a patient encounter that is characterized by an existential openness, a skilled form of presence that allows you to listen to the fullness of your patient's concerns. And so to illustrate what I mean by existential openness, I want to end by recounting a story of something that I witnessed when I spent time with a nurse practitioner who I'll call Michelle. So I sat with Michelle one day while she was meeting with one of her patients, who we'll call Mr. George, and Mr. George had congestive heart failure. And as Michelle was sitting in her office, she learned that Mr. George had gained 7 pounds in the past 2 weeks. So for the non-providers in the audience, rapid weight gain from fluid retention is one of the classic signs that something is amiss for someone with heart failure. But what is amiss in any one instance could be any number of things. It could be a worsening of the condition. It is a chronic condition. It only gets worse. It doesn't get better. It could be a change in diet, an increase in salt. It could be a problem with his medication. So this was a slow-moving emergency, but it was an emergency. Because if Mr. George retained too much fluid, it might eventually move to his lungs and he might find himself struggling to breathe. Now, someone with heart failure has a doc, they have a cardiologist, but sometimes the job of a primary care provider is to be the one who makes the decision of whether you can be treated in primary care without going to see the specialist. But also their job can be to decide if it's important to do the kind of networking work, making the kinds of phone calls that can get a patient in front of the specialist sooner rather than later, which is to say a well-placed phone call from a provider can turn a 2-month wait into a 2-day wait. So when I watched Michelle at work, this is what I saw. I watched as she spent half an hour listening to Mr. George describe how he took his medications and when. Because Mr. George was not conversant with the names of the medications he took, she showed him pictures of each of his pills as she asked him when he took them. She was meticulous in her questioning. And when she got to one of his last medications, Mr. George said, "Michelle, this one I take halfways." And she stopped and she asked, "Mr. George, what do you mean by halfways?" And after a bit of questioning, she learned that he was only taking half of this pill. He was concerned about side effects, and he thought he felt better when he took less of it. What he didn't know was that the pill he was taking less of was one of the medications that helped him manage his heart failure. So in hindsight, this was a clear problem of medication compliance or a problem of patient education, the kind of problem you might, if you're in a well-resourced practice, refer to someone who's not a primary care provider. But the nature of the problem only appeared in hindsight. Michelle had to ask the questions and she had to listen before she could know. And those open-ended questions were key. Because if she had simply asked him, "Mr. George, are you taking your pills?" he would have reported honestly, "Yes, he did." Or if she had simply looked at the numbers, she might have sent him off to the cardiologist and he might have had his medications changed or increased unnecessarily. So it wasn't watching interactions like this that I really began to understand what it meant to think about nursing practice as nursing difference. That when folks say that nurses listen or that they care, they're not talking about how much they smile or how nice they are. Of course, being nice is always great, but it's not about that, right? It's about a practice. It's about a cultivated skill. Because this open-ended conversation did not just make Mr. George feel listened to or cared for, but it mattered for the medical management of his chronic condition. But the other thing I learned is that this listening had another function, because it was through listening through which Michelle didn't just learn about what she wanted to know about, which is how he was taking his medications. She also had a moment to learn from him and how he expressed his own ideas about how each of the medications that he took made him feel. In the context of this conversation, he was able to ask questions of his own about why he was taking certain pills or why the pharmacy switched his medications from brand name to generic. She learned how he reasoned about which pills to take and when. She learned that despite not knowing which pills were for which condition, he was otherwise willing and compliant with taking them. So in addition to learning why he was retaining fluid, she learned about his support network, his personal resources, so that if she needed to help him problem solve a different issue in the future, she'd have a better idea of how to make that happen. Michelle, by the way, started in nursing decades ago as a diploma nurse. You don't see very many of those anymore. And she too brought all of that experience to bear, combined with her training and her expertise to treat patients like Mr. George, to help them live the best version of their lives as best she could. This existential openness to the fullness of the patients you see is one of the many things that makes you different. And I tell you this because often when people talk about the value of advanced practice nurses, they talk in terms of sameness. They talk about how well you can replace other kinds of providers. Healthcare economists and hospital administrators, maybe even some of your friends and family, believe that your value is measured by how closely you look like a physician. And physicians most assuredly have their role to play. They are valuable and valued members of the healthcare team. But I want you to remember that your value cannot be measured by how closely you look like anyone else, but in how you practice as yourselves, because you are not replacing, you are adding. You are adding something unique and valuable to healthcare through being a nurse to your patients. So I will end where I began, by congratulating you in advance for meeting the needs of patients like Mr. George, who will have found in you a willing ally as they navigate a social and economic terrain that is often at odds to their quest for health and well-being. Congratulations to the graduating FNPs for making the phone calls, navigating the bureaucracies, and negotiating the confusing network of systems that your patients are forced to navigate as you provide primary care. Congratulations to the graduating mental health NPs who are really on the front lines of meeting the needs of patients who have really been left to fend for themselves with their mental health care needs. Congratulations to the women's health NPs and nurse midwives for having proven you have the courage to meet the needs of your patients during an historical moment that is openly hostile to the idea of supporting the full scope of reproductive and maternal health care. Congratulations to the DNPs for not only helping individual patients clinically, but helping to improve the larger systems in which your colleagues work and where we all receive care. And congratulations in advance to all of you for remaining true to your commitment to practice from the fullness of your lives, from the fullness of your expertise and knowledge, and from the fullness of your experience of being a nurse. Thank you.